Hello and welcome. Today we're going to be decoding a health issue that is incredibly common but, believe it or not, often misunderstood. We're talking about the urinary tract infection, or as you probably know it, the UTI.
You know that feeling, right? That sudden, really persistent urge to go. Maybe it even comes with a burning sensation. It's just uncomfortable, it's disruptive, and it can really make you wonder, what is actually going on in my body? Well, today we're going to get to the bottom of exactly that.
So here's our game plan. First, we'll nail down what a UTI actually is. Then, we'll cover the symptoms you need to watch for. After that, we'll look at how doctors confirm a diagnosis, what the road to recovery looks like, and finally, we'll get into why treatment isn't a one-size-fits-all kind of deal.
All right, so first things first. To really understand how to deal with a UTI, we have to get crystal clear on what it is. Because you might be surprised to learn that the official clinical definition is a little more specific than most people think.
And this right here is the crucial part. A UTI is a two-part diagnosis. See, it's not enough to just have some bacteria in your urine. That can actually be harmless. And on the flip side, it's not enough to just feel like you have the symptoms. A true UTI is the combination of both. You have the classic symptoms, and a lab test confirms that a significant number of pesky bacteria are causing the problem.
Now, what's really interesting is how doctors approach these. They don't treat all UTIs the same way. They're basically split into two big categories. You've got uncomplicated UTIs, which usually means infections in adult, non-pregnant women. And then there's this huge bucket called complicated UTIs, which includes, well, almost everyone else, men, children, pregnant women, and anyone who gets these infections over and over. This distinction is absolutely vital because it changes the entire treatment plan. Okay, so we know what a UTI is, but how do you know if you should even suspect one? Well, the good news is your body sends out some pretty clear signals.
And just how clear are those signals? Well, think about this. If you suddenly start having painful urination or that constant feeling like you need to go, there's a 50% chance it's a UTI. That's a coin flip. Those two symptoms alone are such powerful clues that they're almost always what gets someone to pick up the phone and call their doctor. You know, it's just as important to know what is not a typical symptom. There's a really common myth out there, especially concerning older patients, that things like confusion or dizziness point to a UTI. But the evidence just doesn't back that up. These are not reliable signs. And that misconception can be a big problem, leading to unnecessary antibiotics, while the real cause of the issue gets overlooked. So, let's say you have those classic symptoms. What happens next? This is where the doctor's detective work really begins, as they move from the clues you've given them to hard evidence. The process is actually pretty straightforward. It all starts with you describing your symptoms. Then you'll provide what's called a midstream urine sample, and that's important for getting a clean sample that isn't contaminated. Right there in the office, the doctor will probably do a quick urine dipstick test, and depending on what that shows, they might send the sample off to a lab for a culture to figure out exactly what kind of bacteria we're dealing with. That little dipstick test, it gives fast, really valuable clues. If both nitrites and leukocytes show up positive, there's about a 90% chance you've got a UTI. And for uncomplicated cases, treatment usually starts right away. But if both are negative, the chance drops all the way down to just 15%. So, in that case, a doctor might hold off and just wait and see. Anything in between is kind of a gray area, and that's when a lab culture is definitely needed to get the final word. Okay, so the diagnosis is in. What does the path to recovery look like? Thankfully, when it comes to treatment, the guidelines are very clear and well established.
Treatment pretty much always means antibiotics. But for how long? Well, that depends on that diagnosis we talked about earlier. For a simple, uncomplicated UTI, a 3-day course is usually enough. For a complicated one, that gets bumped up to 5 days. And if the infection has traveled up to the kidneys, which is a much more serious condition, you're looking at a longer course, typically 7 to 10 days of treatment.
But get this, here's a really fascinating fact. Not every UTI actually needs immediate antibiotic intervention. It turns out that about a quarter of all uncomplicated cases will clear up all by themselves within a week. And that's exactly why, for really mild symptoms, a doctor might suggest a wait-and-see approach, to avoid using antibiotics when they aren't totally necessary. And here is some really good news for your recovery. Once you've finished your course of antibiotics and you're feeling back to normal, that's it. You're done. As long as all your symptoms are gone, there's no need to go back for another test to prove the infection is gone. Your body's already given you the all clear.
So for our final section, let's circle all the way back to that complicated UTI category. This is where context is everything, because managing a UTI has to be tailored to specific groups of people. It's definitely not a one-size-fits-all problem.
So, the standard rulebook often gets a rewrite for a few key groups. We're talking about pregnant women, children, men, people who use catheters, and residents of nursing homes. For each of these groups, doctors have to follow very specific protocols to make sure treatment is both safe and effective.
Let's start with a really crucial exception to the rule: pregnant women. This is the one and only group where doctors will treat bacteria found in the urine even if there are zero symptoms, none at all. This is done as a purely protective measure to safeguard the health of the pregnancy from any potential risks.
The approach with children is, as you'd expect, extremely cautious. Any child under 2 years old with a confirmed UTI is actually hospitalized to manage the infection safely. And for young kids, just one UTI is often enough to trigger a referral for more tests, just to make sure there aren't any underlying anatomical problems causing the infections.
So if we boil everything we've talked about down to its essence, it really comes to this simple, powerful principle: no antibiotics without a test, and no test without symptoms. These simple rules are what protect us from overtreatment and help ensure we're using our most powerful medical tools wisely. It's a simple idea that, in the long run, helps keep all of us healthier. Thanks for tuning in.